All right, our next topic that we're going to talk about, which occurred on day 2 of ATSNJ 2022, was a fantastic, insightful presentation by Daria Oller that really was hammering home some of the things that we need to know about long COVID, the mystery that we're all really need to be more aware of these days. And as someone who personally lives it, as you're going through, while also being a huge advocate for athletic trainers and physical therapists and people all over the world to have a better understanding as we continue to grow with this. I want to thank you for bringing this topic to the limelight, recognition, assessment, and management of long COVID. So Daria is an athletic trainer and a physical therapist. She's a PT with Proactivity in Lebanon, New Jersey. And she's also a co-founder of Long COVID Physio, which is a really amazing community and resource that's growing that we're going to learn a little bit more about. But first off, thank you so much. Can you just tell us in the most simple way possible, what is long COVID?
Sure. Long COVID happens after somebody has their acute COVID-19 infection, that they continue to have symptoms. So this could be that they just never got better, the symptoms continued. It could be that the person felt like they had a recovery and then the symptoms appear, or somebody can even be asymptomatic acutely and then symptoms will start to pop up a few months later.
And you mentioned there's something like over 200 various symptoms that have been shown, right?
Yes, it seems to affect all body systems. It doesn't affect everybody the same, but there have been over 200 symptoms that are recorded in the literature.
It's amazing, and it's amazing how complex yet still how much we don't know about it. And you really also talked about the neuroimmune aspect of it, kind of similar to myalgic encephalomyelitis. Did I get that right?
Yes.
All right.
Yes.
Talk about that real quick too, how it's similar with that neuroimmune issue.
Yeah, so we're seeing this a common trend with long COVID and we'll call it ME, myalgic encephalomyelitis, where some of the really common symptoms are people sleep, but it's not restful. You wake up and you still feel horrible that you didn't get good sleep, that there's a really poor response to exercise. So it's different than being deconditioned. We know when we exercise test people, if there's a 2-day protocol, typical people will do fine day 1 and day 2, sometimes even better day 2. People with ME or long COVID will significantly do worse on day 2 on a treadmill. They will have worse, like sick symptoms, not just being tired or having some like DOMS or just general fatigue going on. And even just having multi-systems that are affected, having a fluctuating symptoms, having it be episodic, there are a lot of similarities with ME that we're seeing. This seems to be common with post-viral illnesses.
And you mentioned during your presentation that there's really no official way to test for long COVID. It's just more of an observation and open communication and being a good listener more than anything. What should athletic trainers be looking for, not only in cases where they know an athlete has had COVID previously, but also maybe in just weird cases that might pop up? What are some things they should really be looking for?
Some of the big things are kind of just something's not making sense. Something doesn't seem right, where especially if you're working with a team or school where you know the kids, or you know, like say the college athletes, they're not responding to exercise typically. They're really, really fatigued. We'll see cognitive impairments also. So maybe you're noticing word finding issues or just like some memory difficulties that you wouldn't expect to see. Sometimes we will see some breathlessness. So people will start breathing a lot using their chest and their shoulders and their neck when they're not exerting themselves physically at all. And again, because there's so many symptoms and it's multi-systemic, there isn't like a set thing we're looking for. We're just like, you can't attribute the symptoms to something else. We're ruling out other medical things. You're sending them to the appropriate referrals to make sure nothing else is going on. And you, again, like you said, you may or may not know that they had COVID initially, but just things kind of aren't lining up. And somebody, when you know them, you're like, this doesn't seem like you. You seem a little bit off. You're not responding typically to physical exertion, cognitive exertion, or even like social or emotional exertion.
And you indicated the importance of wearables potentially as well to monitor heart rate variability. You even mentioned about respiratory rate changing in addition to just strategy. So those are things, if athletic trainers have those resources available, can be helpful as well.
Yes, yeah. Tremendously. And teaching people how to use the wearables. You know, I think most of us just use them as step counters, but to actually teach people how to look at their heart rate, not only just like the general trends over the day, but like in a moment, if you're feeling kind of weird or off, that like see what your heart rate is, see what your HRV is, or if you have a Garmin, it gives you a stress score, and start to know what's normal for that person, or maybe it's not a true baseline normal now, but kind of where they tend to be, and seeing if you could start to correlate some of that data with some of their symptoms.
Got it. And you alluded to a little bit earlier about that rebound effect, having a bad response to exercise. Can we really specifically talk about PESE, post-exertional symptom exacerbation.
Yes.
What happens with that? What does that look like, and why is it not good?
Yeah, there's a whole range. So what we're seeing is, and I don't think I've actually mentioned this earlier. So we don't have a normal aerobic system anymore. Like your body is not responding appropriately to exercise and other types of exertion. So you hit your ventilatory anaerobic threshold much sooner. You're not getting energy the way you normally should, to put it kind of simply. And it really can range. For some people, they just feel a little off, a little groggy, tired. Some people get fever. Some people start sweating more at rest. There's headaches, breathing difficulties. There's a whole range of symptoms. And that literally is just in response to exercise or other physical or cognitive exertion. And on the more severe end, people can have what we call crashes, where they literally can't get up. They don't have the energy, the physiologic energy available to speak. There's thought there might be some mitochondria damage that's happening. We're not entirely sure yet. And you'll hear some of us say, like, we're crashed. Like, you might be like, we're in the middle of this. And so it's not necessarily a discrete episode, like just right now for a couple of hours, but it can sometimes linger for days, weeks, and months.
It's amazing how, you mentioned DOMS, and that's probably the first thing that people go to when they think this is happening. But the way you described it, it is completely different than that. It's multi-system. It's a complete just crash versus just muscular soreness.
Yes,
so it's important that we're looking for that.
Yes, and some people can have musculoskeletal pain. We're starting to see that, whether it's like muscular or joint pain. And it's important to kind of tease that out too and see, like, is this a similar, oh, it's hard for me to go down the stairs because my quads are sore kind of thing, versus just like a kind of general all over pain or joint pain.
And that plays a role into return to activity after being diagnosed with COVID. Can you speak to return to play and how it's really more important to monitor certain things versus a set black and white time frame?
Yes, this is something I get asked often, because especially as ATs, we want to get people back to sport, to dance, to whatever their physically demanding jobs are. But right now, like, if somebody has long COVID, the priorities are getting, if they have autonomic dysfunction, because we see that when you can't regulate your heart rate and your blood pressure and body temperature normally, that needs to be under control. Seeing that those crashes, PESE, aren't happening, or hopefully not happening often if they still are. So there's so many other things that have to happen before we even start to think about actual exercise, where early on it might be movement, stretching, maybe a yellow TheraBand, really light things, but way before we even think about actual exercise and sport. There, unfortunately, most of us haven't been able to return to where we previously were. So when you see those protocols for someone with acute COVID-19 to return to play, you always have to keep in the back of your mind, but what if there's long COVID? Because those protocols don't account for it. And they're looking at cardiac symptoms, respiratory symptoms, which, are really important, but they don't account for those 200 symptoms. So if you're only looking for those cardiorespiratory things, it's really easy to miss, like, oh, that headache, that brain fog, that, like, just that feeling off, that malaise, that actually could be PSE, and the indicator that they can't play yet.
Absolutely. And I'll be sure to put a link in the show notes for a lot of the resources that you shared from today, because I think without having an understanding of what those 200 symptoms are and what those weird things are that you might pick up, that it's very easy to miss, I'm sure, as an athletic trainer. And the biggest takeaway that I got from today was your stressing the importance of being an advocate and listening to your athletes, because other people may think they're just, they're being soft, they're making that up. That's not real. It's in your head. It's psychological, when it's not. This is truly a physiological thing that's going on. We just don't understand it yet.
Exactly. Yes. And it's so important to, even if you think it sounds weird, that doesn't sound real, that doesn't sound impossible, believe people. Because I will say from personal experience, from me and the unfortunate many healthcare professionals I know with long COVID, that the really weird, strange things happen on a daily basis.
Well, thank you for sharing your personal story, Daria. Thank you for bringing this topic to ATSNJ, and for all of your continued advocacy with long COVID physio. So continue that fight, and hopefully sooner than later, we'll have more answers to figure this out, to help other people like yourself, and for athletic trainers to help the people that they serve. So thank you for taking some time.
Thanks. Thank you for having me.
Absolutely.